Good afternoon, everybody. Thank you for stopping by and taking the seats. I know they're pretty comfortable. You could or choose to listen to me or not, that's all right, but enjoy yourselves while you're here. A couple more minutes to start, and this is going to be part instruction, part semi-magic show, part you'll see some of my drawings and stuff. So the whole idea came up when we decided to kind of do something practical and kind of share what's actually coming down the road. There are several people already using these kind of devices, and they're very handy. Now, whether they compare with standard big box spirometry, time will tell, but the general initial data is that they're pretty reliable. So I'm a pulmonary critical care doctor, trained in the US, worked here, moved back to India. So I kind of use these devices in India. And I'll tell you why it's relevant to a country like that and like many places where access to spirometry is actually not easy. There's also a significant cost for spirometry, and devices like these I think will kind of make it easier for people to access testing and also monitoring therapy. I did test one of these devices for my hospital system, so that's my conflict. And the bigger question is, why should we even do spirometry nowadays, and why should we even think about testing somebody for a lung condition? We'll talk about why it needs to be portable. We'll share some clinical applications, and we'll talk about what the challenges can be and what's next. I'll try to show you kind of one of these devices so you can kind of look at it. I think in the exhibit hall there are probably 2 or 3 people doing things like this. I think that's why we need spirometry. There's several billion people in the world who are exposed to biomass, wood fire, dust, indoor air pollution, who have COPD and don't know it. The saddest demographic that I see in my practice is the 55-year-old woman who has extremely low FEV1s, like a smoker, and it turns out she was, inhaling her husband's tobacco smoke and also cooking with wood fire. Many people have stopped using wood fire now, but they've actually have switched over to clean gas. But unfortunately, the impact that they had when they were younger is now showing up. There are many people actually working on creating alternative fuel stoves and cooking apparatus, and that might impact how this is done. So I think it's important to go out in the community and test people for early obstructive airway disease to see if you can actually impact and make a difference. This is a global map of the incidence of death from COPD, and as you can see, it's fairly widespread. The bigger colors, the darker colors are the higher prevalence, and this is in 2012 taken from a WHO publication. And it's definitely something that we've all heard about, but as practicing clinicians or researchers, I think it always helps to remember why you're doing this, because when you can't breathe, nothing else matters. That's my version of the classic 20 to 30 ml decline paper from the BMJ from the 1977, where they tested a bunch of smokers to see what happens to their lung capacity. Obviously, if you keep smoking, you're going to go downhill pretty fast, but everybody loses about 30 ml of FVC and FEV1, and then as time goes on, it increases if you smoke, but if you quit, it does get better. If you quit, even if you're older, you still get an improvement in your lung capacity, and your FEV1 and FVC does get better. So why go portable? And I think, as I mentioned and alluded to earlier, it's a fair amount of inconvenience for many people to get to a referral center to get tested for, say, lung capacity or FEV1. Although it's vital that they actually do it, there have been many programs where they've gone out into communities and with portable spirometers and larger ones and tested it. But I think the future is going to be right here. How many of you have an iWatch on you? An Apple Watch? Okay. How many of you have activated the ECG algorithm on it? Have you tried it? All right. Rhythm fairly regularly, and you can do it when you're exercising and see what your rhythm's looking like. And this is active right now in front of you. And it's very easy for somebody to check their air capacity and lung capacity. It's coming down the line. It's going to be there in a few months, weeks, I'm not sure. But people are going to come in and say, you know what, doc, my heart rate's 140, it's sinus tachycardia, and my FEV1 was 1.2 liters. I smoked. What do I do now? I tried an inhaler from my last doctor and the FEV1's improved, but what do you think I should do now? So the people are going to come in and talk to you with very specific information, and I think the portable spirometer is a good way to actually have them take charge of their health and also assess what their lung capacity is in their workplace, in their home, where they're actually located. It's a fairly replicable test. There's also devices coming out which are testing linkages to air quality and the ambient humidity, and to see if there's actually a difference depending on where they are. I'm not sure how many of you have seen the TED Talk, but there's a guy who's come up with a tiny air pollution tracker, and he mapped out the roads of London to see which is the place with the best air quality. And incidentally, the air quality actually changes very quickly. So if you have a main thoroughfare with all traffic, it's going to be pretty high. AQI is going to be high. But as you move to the side streets, it's going to come down. So they map out a route for you to run or jog or cycle, go biking, where you can avoid those high polluted areas. And this is even in a city like London, which is pretty clean compared to, say, countries like cities like Delhi or other places. Even there's a significant variability. So it may be helpful to assess what happens to the lung capacity along with a matching air quality indicator. There's about 7 million deaths from air pollution, and it's kind of shocking, but there's about $5 trillion cost to the world from poor air quality. And as pulmonologists, we're going to be seeing the impact of this over the next several hundred years, I think. In this, I just want to kind of share a few examples of devices. So there's one in this exhibit hall. This particular one's a tiny one which actually measures the FEV1 FVC, has a display, and then disconnects to the through Bluetooth to your device, your smartphone. And of course, the technique's important. I mean, you've all been to the jazz places. I don't know how many of you went. It's like 2 streets down from the Marriott Hotel yesterday. That was really good. So this guy was like puffing away, and I was like, wow, his air capacity must be really good. And this is what I tell my patients: blow as hard, as fast, as as long as possible. It's not easy, but that's what you need to do to get a good study. Which planet is that? Anybody hazard a guess? Neptune? Moons of Jupiter? Anybody? What planet is that? Take a guess. It's the one we're on. It's the Pacific Ocean. Sometimes you have to look at the world a little differently. Sometimes you have to kind of spin things around and take a look at what looks familiar to and kind of look at it differently. I mean, it's a lot of water on the planet. But the reason I put that slide up on many of my talks is even a simple thing like spirometry, you need to step back and say, can I make it easier for my patient? What can I do to actually measure the impact of the treatments I'm giving them? And I think science and technology has given us options now to actually do measurements on the spot, and things like that will help us. So this is a display from one of my patients. This is a 58-year-old, he's a CEO of a large company. He has a kidney transplant, and he's had Castleman's disease. And in addition, he has COPD from smoking a long time ago. And he's on transplant meds, etc. So he keeps getting these lung issues. And I say, he's traveling all over the world, and he's having issues with his lung capacity. So he just takes, I'll show you the device. He takes it, blows into it, kind of WhatsApps it to me or emails it to me, and I look at it and say, increase your. Or sometimes I say, no, I don't think you should hold on, either come back home or go to the doctor in that area. So he's always in touch with me about his lung capacity, and he blows into it, and I get these readings, and I'm able to kind of treat him. So the current applications include home-based monitoring, post-discharge monitoring to see if the impact of your therapy has worked. You can also do it in home care, occupational health. Transplant patients can use this to monitor their lung capacity. You can do a screening camp and use these kind of devices to kind of make it pretty easy. And of course, you can use it for research. Many companies are using these devices in the community setting to actually test the research. Much time okay? Good. Great. Of course, the challenges are, I think, the awareness. Clearly, 20 of you are aware now. It's probably 50,000 who don't know that these things exist. And it's like that for everything. There's this concept of don't know what you don't know. So there's a lot of these ideas in medicine which, unless you really look and come to a conference like this, you won't learn. So there's a lot of things I learned. So I think it's important that we promote these kinds of simplifying things which will help patients. We do need larger databases. I didn't put slides up, but there are many ROC curves which show that there's a pretty good kind of fit between the standard large spirometry, the traditional ones, and these devices. The care model has not yet been evolved. It's an anecdotal thing. I'm taking care of my patient who's traveling the world, but you need a better care model, and people are working on business models where you can use the device to actually build a COPD care platform using these. We don't know the long-term impact of using these devices. How long are they going to last? Is there going to be like errors that are going to creep in over time? And of course, just like the iPhone, how many of you have the new iPhone? I mean, it keeps changing every year. So you may need to change the device as time goes on. And of course, technical issues of the user not using it right, dropping it, breaking it, things of that nature. So what's next? Like I mentioned earlier, the AQI, the air quality index, is going to get integrated into these devices. Some people are already working on that. You can do multi-parameter monitoring, say oxygen saturation along with your cardiac rhythm, and that can be done pretty easily. And video feedback. So there are some apps which can, and devices where you can actually talk to your doctor through the device or through your phone and right away tell them, you know what, these numbers are not good. You need to start doing 1, 2, 3. So I think the question here would be, do you see value? I'll show you the device right now, one of them which I have, and invite questions. And I'll just finish up and then we do the questions. But I think, what the mind does not know, the eye does not see, and the ear does not hear. I kind of believe in this because unless you're aware, you're not going to know that these things exist. And I just want to thank you and never stop learning, because that's, you just can always get teaching from ACCP.